Good morning, everyone. I hope you are doing well. Let me know if you can hear me. Okay. All right. So good morning. Good morning. Let me know if you can hear me from your end. Let me know if you can hear me from your end. Okay. Good. Perfect. Okay. Let's start. Uh, so today is questions. So you post the answers to the page. Okay. And we analyze. Okay. Perfect. Okay. Right. So we will try our best. It's 100 questions, but let's try our best and see how how best we can go. Okay. We are doing some 2 hours online, between 1 hour 45 minutes and 2 hours. Okay. Right. So question number one: a, a client admitted with major depressive disorder tells the nurse, "My family will be better off without me." Which response by the nurse is most appropriate? So send the answers to the chat box. Okay, and we go through. Yes, yes. Everybody should answer the question. Okay, don't just be a spectator online watching what is going on. Try and type, participate. Okay, so that you will know what is good, and you also develop your participation skills. Yes, good. Everybody should participate. Everybody should participate. Everybody should participate. Right. So my family will be better off without me. Okay. So in Nclex, I told you something that when you see any statement in the apostrophe, this one, this, if you see any statement written here, these two symbols or those apostrophe signs, they will make like this, they will make like this, or they will make like this, or they will make like this, and all those apostrophes are like those signs. Okay. When you see any statement in it, it is either where you find the answer or it is leading you to the answer. Okay. So all these things, all these big sentences we are seeing here, the answer is only here. Okay. Or it's either leading you to the answer. So my family will be better off without me. What is the you asked us? So what is the meaning of this English? Let me try and explain the English. And the English says even if he doesn't exist or she doesn't exist, okay, the family will still do well. So this is a suicidal language. Okay, right. So definitely C is going to be the answer. Okay, let's continue. Question number two. A client with schizophrenia says the television anchor is sending me secret messages. The television anchor is sending me secret messages. Which response by the nurse is best? So, like the first question, the answer is either here or is leading you to the answer. So, shoot your answers to the chat box, please. You write the question number, then the answer beside it. Good, good. I need more answers. No, don't send your answer here. Right. So, question number two, the answer is I do not see video evidence of that, but I understand that it feels real to you. Okay. Yes. So, this is a two-part statement. Okay. This part and that part. So, this part and that part. So, this part is being real. Okay. This is talking about the realities. You are being truthful and honest to the patient. And this part is acknowledgement. Okay, you acknowledge again. So acknowledge whatever the patient is going through. Remember, in psychiatry, we said that you acknowledge, but you don't validate their feelings. So you acknowledge, you respect their feelings. Okay, but you don't validate it. You don't confirm it for them. Okay, perfect. So two is C. Question number three. The nurse is the client is pacing rapidly, breathing fast, and saying, I am dying. Which action should the nurse take first? Question number three. Send me your answers. Okay. Question number three. Okay, so question number three, patient says, I am dying. Okay. Yes. So what are you going to do? Client is pacing rapidly. Okay. This is an ampersand, breathing fast and saying, I am dying. What should the nurse do? So the answer is B, stay with the client and speak calmly. Okay, yeah, so far so good. Right. So question number 4. A client experiencing mania has not slept for 3 nights and refuses to sit for meals. Which appropriate intervention is most which intervention is most appropriate? Okay, it's most appropriate. Yes, question number 4. Shoot your answers. Okay, question number 4. Okay, question number 4. So this is a mania case. Okay, bipolar case. So this client has not slept for 3 nights and refuses to sit for meals. Okay, which intervention is most appropriate? So encourage a 3 meal course, provide portable high water calorie. Okay, restrict fluids to decrease activity, and D, schedule lengthy group therapy. Okay, so B stands out. Provide portable high calorie foods. And so we said that many people, their problem is about eating and balancing. Okay, food balancing. Yes, so you give them finger foods or handy foods that they can even walk around and eat with it. Eat it. Then also those that food that you are giving them, it will be very nutritious so that it will balance their nutrition. Okay, perfect. So the question number 5. A client taking lithium develops cause tremor, vomiting, confusion, and unsteady gait. Which action should the nurse take first? So I'm giving you a clue. Cause tremor. Number 5, shoot. Okay. So question number 5. So question number 5, this clue alone tells you that it has moved from the normal side effect to an adverse side effect or toxicity stage. Okay. Yes. So when you see cause tremor, it means that you are getting what lithium toxicity. Okay. So anybody who is getting lithium overdose and is causing toxicity, definitely you hold the lithium and obtain urgent evaluation. Okay. Yeah. So 5 is B. Question number 6. A client with schizophrenia says, the voices are telling me to jump from the window. What is the nurse's priority action? What is the nurse's priority action? What is the nurse's priority action? Question number 6. Okay. So remember the same apostrophe. So understand this sentence or this phrase and use it to answer your question. Okay. Right. So question number 6. Okay. So this is a clear statement of commanding hallucination. Okay. Yes. Commanding hallucination. And this is we are dealing with a schizo patient, and this sentence is a command hallucination. Hallucination is a positive symptom, not a negative symptom. Okay. Yes. Why is command hallucination important? Command hallucination, we take Nclex takes key note of that because of safety. Safety in the sense of the patient can harm himself or harm others. Yes. So looking at the options, A stands out. Ask what the voices are saying and assess immediately. Okay, A stands out. Perfect. Right. So when you get a slide, then you try and go through again. That's why I'm not answering there. I'm not leaving the answers on it. Okay. Right. Question number 7. A client taking an antipsychotic develops a temperature of 40 degrees. Okay. Severe muscle rigidity, confusion, and tachycardia. Which complication should the nurse suspect? Okay. A client taking an antipsychotic develops a temperature of 40 degrees, severe muscle rigidity, confusion, and tachy. Which complication should the nurse suspect? So the temperature is the key word here, and muscle rigidity. So muscle rigidity and temperature. Use it to answer your questions. I'm giving you the clues. Good. People are doing really well. Good. I admire your answers. Good. 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 Yes. So this is a clear sign of neuroleptic malignant syndrome. Okay. Neuroleptic malignant syndrome. So at this stage, you should note that the patient has developed an irreversible problem. Okay. Irreversible neurological problem as a result of taking this antipsychotic. And definitely, this is going to be a first generation antipsychotic. First generation antipsychotic. So, haloperidol, okay, haloperidol and CPZ, chlorpromazine, any of these two guys. Okay, we did it yesterday. So, you should go and get the slide and refresh your mind. Okay, perfect. Now let's go to question number 8. Question number 8. A client taking sertraline and linezolid becomes agitated, diaphoretic, febrile, and hyperreflexic with what? Clonus. Which condition should the nurse suspect? A client is taking sertraline and linezolid, becomes agitated, diaphoretic, febrile, and hyperreflexic with clonus. Which condition should the nurse suspect? Okay, question number 8. So this is a question of the clue. They have given you the clue. Analyze the clue and diagnose it for me. So clue analysis question. Good. Question number 8. Question number 8. Question number 8. Yes. Everybody should answer. Try and answer. Okay. Good. Perfect. So, linezolid sertraline is an SSRI, and linezolid is a monoamine oxidase inhibitor. Okay. It is advised that when you are taking monoamide oxidase inhibitor for the, don't take it with these guys. Okay. Yes. Otherwise, you get serotonin syndrome, serotonin crisis, serotonin overdose. Okay, because all of them work with the same physiology to ensure that serotonin crosses, okay, to the other side of the nerve, and reaches the cell. Yeah, so that is it. Number 9, a client taking clozapine report fever and sore throat. A client taking clozapine report fever and sore throat. Which action is most appropriate? Okay, so the fever and the sore throat is my clue for you. Question number 9. Question number 9. Everybody should answer. Okay, take part in it. Question number 9. Everybody should try and answer. Good. So this is a clear sign of neutropenia. Okay. This is a clear sign of neutropenia. So the doctor must know, okay, notify the provider and anticipate blood count evaluation, CBC or FBC. Okay, CBC, take blood sample for CBC to know the white blood cell count. Okay, right. A client experiencing alcohol. Question number 10. A client experiencing alcohol withdrawal has tremors, diaphoresis, tachycardia, and increasing agitation. Which complication should the nurse monitor for? Alcohol withdrawal. Number 10. Good. So you are looking at seizures. Okay. If you don't do anything about this, you are getting, the patient might get seizures. Okay. And sometimes delirium tremens. Okay. Yeah. So a case like this, you have to do your CY. Remember, you do your CY. Okay. Your CY. Okay, your CWA scoring is very important. Then when you get the score, you based on the score, you give your phenobarb or your barbiturates, phenobarbital, okay, or your barbiturates. right? So you give this medication to prevent seizures and delirium tremens. Don't forget to, okay, right? Question number 11. Question number 11. Let me squeeze the screen a little. Okay. So a client is found unresponsive with a respiratory rate of 5 per minute and a pinpoint people. Which medication should the nurse anticipate? So this is my clue for you. Number 11. Shoot your answers. Send me your answers. Right. Number 11 is a case of naloxone. Okay. Pinpoint needle. Opioid intoxication. Okay. Perfect. Number 12, a client with OCD, obsessive compulsive disorder, spends 45 minutes washing hands before meals. Which nursing approach is most appropriate initially? A client with OCD spends 45 minutes washing hands before meals. Which nursing approach is most appropriate initially? Question number 12. Everybody should try and answer. Okay. Right. So question number 12, the answer is B. You should recognize the ritual as anxiety reducing and gradually address it. And gradually address it. Okay. Perfect. Question number 12. Don't stop these patients. Don't stop them abruptly. Don't tell them to stop. Because when you tell OCD people you stop them abruptly, it increases the anxiety. Okay. Yes. So don't choose A unless there is a clause with the option A. Unless whatever they are doing is going to cause injury or is going to affect safety. Okay, then you stop them. Other than that, don't tell them to stop if it is not a safety situation. Okay, right. Question number 13. A client with PTSD becomes visibly distressed after hearing fireworks. Which response by the nurse is appropriate? 13. Shoot. Good. So this patient has become visibly distressed. Okay. Yes, it is an anxiety situation. Okay. Perfect. So you will stay with them. You are safe here. I will stay with you. Okay. Don't choose this. Tell me every detail of the trauma now. Yes. Don't choose that one. The answer is B. Okay. Perfect. Question number 14. 14. A client with depression suddenly appears cheerful after several days of severe hopelessness. Which action should the nurse take? So, depression, suddenly cheerful. Okay, that's my clue for you. Question number 14. Good morning, Mrs. Everest. I hope you are doing well. I like, good. Listen. Right. So, question number 14. This is a case of suicide. Okay. So, yeah, they have already made their plan. Okay. And they want to execute it. That's why they've suddenly changed behavior. Okay. So, reassess suicide risk. That is B. Okay. That's the answer. Question number 15. A client tells the nurse, I have a gun at home and plan to use it tonight. Which action is the priority? Which action is the priority? Question number 15. Which action is the priority? Which action is the priority? Number 15. Good. 15 is B. Okay. So I have a gun at home and plan to use it tonight. Okay. Yes. So this is a suicidal comment. So initiate immediate suicide precaution and safety measures. Okay, perfect. Now question number 16. Question number 16. A client with borderline personality disorder tells one nurse, apostrophe, you are the only nurse who cares about me. The others are terrible. Which response is best? Question number 16. I like your answers. Good. Right. So question number 16, the answer is B. Okay. Maintain consistent boundaries. Borderline. Borderline, these personality guys, they like splitting. Okay, they like divisions. So among people, yes, and team communication. People like that. We have sometimes we have friends among a group of friends who will tell this person this, tell this person that. That is their nature. So if you see that, communicate with the other team members that guy, this is what this person is doing. Okay. So let us maintain our consistency. So you maintain consistent boundaries and team communication. Otherwise, the patient will split the nurses, will cause separation and all those stuffs, backbiting and other stuffs on the shift. Okay, on the ward. Good. So a client with antisocial personality disorder repeatedly manipulates unit rules. Which nursing approach is most appropriate? Which nursing approach is most appropriate? Shoot. Question number 17. Shoot. Good. So, this antisocial guys too, they also behave sometimes like the borderline guys. Okay. So you use the same formula with them. You set clear limits. You ensure consistency. Okay. Boundaries and also ensure consequences. Okay. So establish clear limits and enforce them consistently. Establish clear limits and enforce them consistently. Okay, perfect. Question number 18. A client with anorexia nervosa has a heartbeat of 42 per minute, blood pressure 86 over 48, and potassium 2.8. Which problem is the priority? Question number 18. Which problem is the priority? Yes. Right. So this is a clear sign of hypokalemia. Okay. And if you don't do anything about these vital signs and lab results, it's going to cause cardiac arrhythmias. Okay. So we focus on the medical, stabilizing the patient medically. Okay. So the patient is having what? Medical instability problem. Okay. Among the list here. Okay. Number 19. A client with bulimia nervosa reports frequent self-induced vomiting. Which laboratory value is most concerning? Bulimia nervosa. Which laboratory value is most concerning? Number 19. I showed you the trick yesterday. So you should know how to get your answer with this type of questions. We are on number 19, so let's focus on answering number 19. Okay. Let's focus on answering number 19. If you are new on the page, remember to subscribe. This is a free channel. We teach nurses who are willing to write NCLEX and travel to the United States, Australia, or Canada. Okay. Yes. And we also educate student nurses who are in school. We teach them and educate them on how to pass their licensing exam in school. Okay. So if you have any friend, you can refer them, refer the page, subscribe to the channel, hit on the notification button so that anytime we go live, you will get a notification and join us. We also have a WhatsApp platform. So if you are new here and you are not part of the platform, we will drop a link for you to join. Okay. Yes. Perfect. Remember to hit on the subscription box. Subscribe to the channel. Okay. Yeah. So this is a clear case that the patient is losing potassium. Okay. So hypokalemia is vomiting out the potassium. Okay. Absorption problem as a result of the self-induced vomiting. Number 20. An older adult becomes acutely confused and attempts to climb out of bed after surgery. Which condition should the nurse suspect first? Acutely confused. Okay, that is my clue for you. Question number B. Acutely. If you understand that English, you are a winner. Question number 20. Yes, so this is a clear sign of delirium in older people. Okay, delirium in older people. Okay, perfect. So the answer is B. Question number 21. A family member says, my father with dementia keeps asking for his wife who died years ago. Which response by the nurse is most appropriate? We are on question 20. Okay, let's not rush to answer question 21. We are on question, sorry, 21. We are on question 21. Sorry. Okay. My father with dementia keeps asking for his wife who died years ago. Which response is best or is most appropriate? Question number 21. Shoot. 21. Shoot. People are on fire. They already know the answers before. Yes. Question 21. So this is a dementia case. Okay. Yes. My father with dementia keeps asking. Dementia people, they keep requesting. So in situations like this, okay, the answer is B. You become calm. You use calm redirection and validation. Okay. Yes. If you correct him forcefully or you tell him to stop asking those questions, it increases anxiety in them and it will make them agitated and distressed. Okay, so dementia patient, they don't remember their past. Okay. Yeah, so you use calm redirection and validation. Okay, perfect. Now, 22, a client becomes increasingly agitated, clenches fists, and begins shouting. Which intervention should the nurse use first? Increasingly agitated. The ing guys. Okay. Clenches fists and begins shouting. 22. Right. So this is a clear sign that our patient is becoming what? Agitated, crisis. Okay. It's moving high agitation. So you use calm verbal de-escalation. You de-escalate and maintain personal space so that the patient does not harm you. Okay. Yes. Don't apply restraint. Restraint is the last resort. Okay. And don't confront them aggressively. Two wrongs does not make a right. So that is it. And they need communication. You should not turn off all communications. Okay. Perfect. 23. A client is threatening staff and cannot be redirected. Which principle should guide the nurse's next action? 23. Is threatening staff and cannot be redirected. Which principle should guide the nurse's next action? Right. So 23. At this moment, no, at this moment, remember they became agitated here. We use words to de escalate calmly. But in 23, at this moment, everything has failed. Okay. All the de escalation, all the calm way has failed. Okay. So we use the last resort. Use the least restrictive intervention that safely controls the situation. Okay. Yes. Yes. So that is it. 24. A client says, I don't know how I can go on after my husband's death. Which response is most therapeutic? Don't know how I can go on after my husband's death. Which response is most therapeutic? 24. Right. So, tell me more. Tell me what this loss has been like for you. 24. Okay. Tell me what this loss has been like for you. Okay. So this is an open-ended statement and encourage or question and encourages expression without minimizing grief. Yes, so that is it. Question number 25. A client coping. Remember, let me make a comment here. Here, here, you are not to minimize grief. Okay. So when somebody's partner or whatever, somebody has a loss, okay, your aim as a health worker is not to go and shut off their grieving. Allow the body to go through the grieving process, okay? Then you support them, you encourage them, you stay with them, okay? Encouraging them. Your aim is not going to ask what happened, what killed your husband, what happened. You are not to ask for the cause of the death, okay? To use words that will minimize what grieving. Yes. That will not minimize grieving. Sorry. 25. A client coping with job loss begins drinking heavily every night. Which behavior does the nurse identify? Which behavior are we looking at? Yes. Defense mechanism. Which behavior are we looking at? I like your answers. Perfect. Right. 25 is a behavior of maladaptive coping. Okay. Yes, they're having issues with adapting to the situation. So they will go the opposite way. If something happens to you, you don't like what has happened to you. Everybody is expecting you. Maybe this person has lost the job. Everybody is expecting that, oh, go to church, pray. These are the socially acceptable put on behaviors that will show that yes, you have motivated yourself. Okay, you are really controlling this situation. Okay, but for you to exhibit behaviors that is opposite what the society expects, we call it the maladaptive coping. Yes, so this guy has lost the job and he has started drinking heavily. Society does not accept that. You are compounding your problems rather. Somebody lost somebody lost the husband or lost the wife, divorce through divorce, and the person will resort that, oh, since somebody snatched my wife, me too, I'm going to date only married women. Society does not like those behaviors. So we call it you are coping all right, but it's a more adaptive coping. Okay. Yes. So this is a defense mechanism. You are using wrong to answer wrong. Two wrongs does not make a right. Perfect. 26. A client angry with supervisor goes home and yells at the spouse. Which defense mechanism is being used? Which defense mechanism is being used? Which defense mechanism is being used? 26. I like your answers. Perfect. A. Aaron Olubumi, come again with your answer. We don't have W. Question number 26. We don't have W in. Okay. Yes, so this is a clear situation of displacement. Okay. So displacement, they look at what? Somebody that they can attack, somebody they can blame. Okay. So they will, for somebody to do displacement, they look through the group, the society, or the people around them who is weak that I can attack. That even if I attack, the person cannot defend him or herself. So the in this situation, the husband was the one the patient chose. Okay, so displacement will go to the husband. Okay, 27, 27. A client says, I failed exam because the instructor made it impossible. Okay, which defense mechanism is this? I failed exam because the instructor made it impossible. Which defense mechanism is this? Sani epe mi enie. Right. I like your answer. 27. 27. Yes, so this is a case of rationalization. Okay. Yes. So in rationalization, you have accepted that yes, you have failed. Something wrong has happened to you. But for them to sit down, or for you to sit down and ask yourself that what actually went wrong? No, you don't want to carry the blame alone. So you shift some of the blame on people that, oh, I failed because the instructor didn't want me to pass. Or the instructor made the question so difficult so that nobody will pass. You did not learn. You didn't learn. So you're using rationalization. Okay. And people who get stuck and fixated with rationalization, they don't learn. If you correct them, they think they are always right. Okay. Yes. Any bad thing that happens to them, somebody has caused it. Okay. A client diagnosed with cancer says there must be a mistake. I am perfectly healthy. Which defense mechanism is demonstrated? Oh, sorry, Lois. Is it better now? Let me know. 28. 28. Right. So 28 is a clear situation of, yes, it's a clear situation of denial. Okay, yes, a clear situation of Sorry, Mr. Everest. Okay, 29. A client directs aggressive impulses into competitive sports. Aggressive impulses into competitive sports. Which defense mechanism is this? 29. 29. 29. Hey, 29. A client direct aggressive impulses into competitive sports. Which defense mechanism is this? Mhm. 29 is a case of sublimation or sublimation, the comfort. Sublimation. This is the opposite of maladaptive behavior or maladaptive. In maladaptive, when they have a problem, instead of doing the socially accepted things, they rather choose to do the bad things. So somebody has lost the job, you will resort to drinking alcohol, okay, so that the life will be basa basa, okay. Yes, that is maladaptive. But with sublimation, they also have a problem, okay. They have a problem. They know they have a problem, but they will resort to doing the good things that the society likes. Okay. Yes, in order to sublime, to kill the problem. So, like the camphor. So this guy knows that what they have become aggressive. So they will redirect it into what competitive sports. Yes, there's somebody is feeling lonely in the house. It feels like, oh, somebody should come and be with me so that we talk and do this. No, the person said no. I want to watch television rather, so that it will take my mind off the bad impulses that is coming into my mind or whatever my body is going through. Okay. Yes. So these are the things you should know. It is not projection. Projection means you are projecting your problem like the projector. So if you give the projector one problem, it will project it to another person, the wall. Okay. So the problem you are having as projection, the problem you are having, you are not taking the problem to solve it alone. You want to blame others. But in projection, you don't select one person who is weaker to blame them. You you can blame anybody. Okay. Yes, so that is projection. So this is 30. Question number 30. A client under severe stress begins speaking. Let me make it big. A client under severe stress begins speaking and behaving like a childlike manner, in a childlike manner. Which defense mechanism is demonstrated? Question number 30. Question number 30. Question number 30. So number 29 tricked a lot of people. I saw people were choosing D. Question number 30. Yes. Question number 30. So far, so good. The only question that challenged people was 29. Question number 30. Okay. So 30 is a case of regression. Everybody got it right. Cool. 31. A client says, I'm not angry. You are the one who is angry. Which defense mechanism is this? I am not angry. You are the one who is angry. 31. Question number 31. Question number 31. Question number 31. 31. 31. 31. Yes. 31. Okay. So question number 31 is a case of projection. Yes. So if you see projection, anytime you have a problem, instead of you to take it, you project it to people. You rather have this problem. Okay. You rather this. You rather. He's not blaming them all, but he is saying that I'm not the problem. You are the problem. Okay. It's a projection. So like the projector, if you give the projector a problem, they will project it to the wall and send it to the wall. Okay. Yes. So this is what you should know. Okay. 32. Question number 32. A client displays, oh, sorry. A client displays excessive kindness toward a person they strongly dislike. Which defense mechanism may be occurring? Somebody has insulted you, gossiped about you. Eh? You don't like, in your mind, you don't like the person, but outwardly, you are giving the person gift, giving the person money, doing things so that others will know that, oh, nothing is going on. But in your mind, you don't like the person. Which type of defense mechanism is this? So pastors mostly experience this in the church. People will be church. Some of the church members will be insulting them. Okay, but he will heal or she will heal. Just that he will behave like nothing has happened. Then you pray for them. They will come for prayers. He will, or she will pray for them. Okay, yes. So, yeah, so this is a clear case of reaction formation. You are reacting to somebody's behavior. So you have formed what? You have formed a certain reaction to somebody's action. That is reaction formation. Okay, perfect. Question number 33. A client with somatic symptoms disorder repeatedly report pain despite extensive negative testing. Which nursing response is most appropriate? Somatic form disorders. 33. Shoot your answers. Let's go. 33. Stanley, come again with your question. Is it always positive? I don't understand. What is positive? Good. Reaction formation. Is it always positive? Yes. So, yes, you don't pay wrong with wrong. Okay. So, reaction positive formation. There are so many examples. I don't know if you want to create any negative. It's positive. Okay. Yes. I would say it that way. So 33 is C. Okay. Somatoform disorders. They are complaining about physical problem, like this patient complaining about pain. Despite all laboratory investigation tests, everything has proven negative. And this patient, so we have seen that no, your problem is not about the pain. It's something that is speaking to your mind. So I understand the nurses, I understand the symptoms are distressing. This is what acknowledgement. Okay. But let's focus on coping and functioning. Okay. Yes. Okay. So question number 34. A client with severe anxiety is unable to concentrate on teaching. Is unable to concentrate on teaching. Which nursing action is best? Which nursing action is best? 34. Which nursing action is best? 34. Right. So this is a severe form of anxiety. So concentration becomes a problem. We did that different types of anxiety yesterday. Okay. So it has moved from mild to severe anxiety. So concentration becomes a problem. Okay. So you reduce the stimulation, whatever is causing the anxiety, and provide short, simple informations. Short, simple informations. Okay, 35. A client with generalized anxiety disorder report constant worry, fatigue, muscle tension, and poor sleep. Which intervention is most appropriate? 35. Which intervention is most appropriate? Good. So the answer is A. Encourage structured relaxation and coping strategies. Yes. So generally, generalized anxiety disorder. The management includes adaptive coping, relaxation, and structured anxiety reduction. Okay, perfect. 36. A client with panic disorder says, I feel like I'm losing control. Which nursing action is the best? 36. I feel like, so there is an apostrophe again here. It's either this is the answer or it's leading you to the answer. So questions like this in Nclex, it is just like the same strategy you use to answer questions like this. It's the same strategy you use to answer apostrophe and all those questions, punctuation marks in IELTS. Okay, in IELTS, academic reading. Okay, IELTS reading. Yes. So it's either the answer is there, or it's leading you to the answer. Good. So 36. Good. So in this case, you're going to remain with the client and provide calm reassurances. Okay. You remain with the client and provide calm reassurances. Remain with the client and provide calm reassurances. Okay. 37. A client with PTSD refuses to discuss the traumatic event. Which nursing response is most appropriate? They don't want to talk about it. What should the nurse do? Okay. 37. Mm-hmm. 37. 37. Good. So in this case, you respect the client's readiness and focus on safety. Okay. Yes, they don't want to talk about it. Why worry yourself to know what is going on? Okay. Right. A client with depression says, I have nothing to live for. Another apostrophe. Which follow up question is most important? Which follow up question is most important? 38. Good. So are you thinking about hurting or killing yourself? Okay. That is B. Are you thinking about hurting or killing yourself? That is B. Okay. 39. A client with mania is shouting, intruding into others' room, and becoming increasingly agitated. Which intervention is best for them? 39. Which intervention is best for them? 39. Shoot. Many people enter everywhere. They go everywhere. Remember to subscribe to the channel. Okay. And hit on the like button. Subscribe to the channel and hit on the like button. Okay. Right. So you provide a low stimulation environment and firm limits. Okay. Yes. Provide a low stimulation environment. Okay. Remove all the stimulus that is making the patient become what? Agitated. Perfect. A client taking lithium asks why dehydration is dangerous. Which explanation is most appropriate? A client taking lithium asks why dehydration is dangerous. Which explanation is most appropriate? Question number 40. Everybody should answer. Type your answers. Type your answers. Type your answers. Good. You are doing really, really well. Okay. So, and dehydration actually causes what? Dehydration can increase lithium levels and toxicity. So when sodium and water gets lost, okay, lithium reabsorption from the kidneys into the bloodstream, okay, also increases. That can increase the toxicity rate or risk. Okay, so the answer is A. Good. A client with schizophrenia is laughing while describing the death of a close family member. Which findings does the nurse identify? A client with schizophrenia is laughing, 41, while describing the death of a close family member. One of the risks of being a nurse is this question, or a health worker. Okay, one of the risks. Okay, right. Yes, so flat. So you get flat feelings. You don't care about whatever somebody's going through. Okay. You don't care about the situation going on. You don't care. You have flat affect. Okay. Flat emotions is zero or inappropriate. Okay. Echolalia is repeating, constant repetition of what somebody is saying. So, like as I'm talking, when I say this, then you also say this. Okay, you'll be repeating. That is, you are echoing my voice or in my words. Okay, right. A client with schizophrenia spends most of the day alone and lacks motivation to perform self care. Which symptoms are present? A client with schizophrenia spends most of the day alone. Question number 42. And lacks motivation to perform self care. Which symptoms are present? 42. Yes, 42. Nana Mafojo, why have you deleted your answer? You need to submit. Oh, okay. I will explain the question later. After. So, a client with schizophrenia spends most of the day alone and lacks motivation. Spends most of the day alone and they lack motivation to perform, okay, self care. Sarah, do you understand now? So these are signs of what? Is it you are reading into the question? That is the biggest mistake you do in Nclex. Okay, don't read into the question. Good. Otherwise, you choose the wrong answer. So this is a negative symptom. These are signs of negative symptoms. Positive symptoms, it has been added. You know, their new behaviors have been added to them. Okay, like hallucination, delusions, and all those ones. Okay, perfect. Question number 43. Sorry, hey, this one is too small. Question number 43. A client says the FBI implanted a tracking device in my tooth. Which type of symptom is this? Yes, 42. A client says the FBI implanted a tracking device in my tooth. Okay. Oh, okay. Sorry, Sarah. Please, I don't understand what you just said. Yeah, so I was explaining the positive and negative signs. Were you here yesterday? Did you join the class yesterday? I organized a class for the ATT group. I don't know if you were part. Genevieve. Okay. Okay, so the positive and the negative symptoms. The positive symptoms are added behaviors. So, like you are somebody who doesn't talk. Okay, you don't like nasty things. Okay, let me use the talking. You don't like talking. You are quiet. One day we wake up, all of a sudden you are become so talkative. You are talking. Nobody understands you. Okay, the whole day, 1 week, 1 month, consistently 6 months, you are talking. Okay, So a new behavior has been added to you. That is a positive symptom. Okay. And on the reverse, the negative symptom, you are somebody who likes talking. Okay. All of a sudden, you have gone mute. You don't like to socialize, you don't like to talk to anybody. You are in your room, always quiet, 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 quiet. You that you always organize programs for us to come. Now you don't want to do anything again. Okay, 1 month, 2 weeks, 3 months, 4 months, 6 months, so many months. So that is a negative symptom. A behavior has been taken away from you. Okay, that's a negative symptom, right? So that is it. Okay, 43. This is a false belief. So it's a delusion. 43 is false belief, delusion. Okay, yeah, it's not true. 44. A client says, I hear a man telling me that I am evil. Which assessment question is most important? 44. A client says, I hear a man telling me that I am evil. Which assessment finding is most important? Shoot. 44. 44. I hear a man telling me that I am evil. 44. So when we get to question 50, we will break. Then tomorrow morning, like we did it today, tomorrow morning we will continue from 51 to 100. So don't miss. Don't miss. Okay. So that people can also go and do other stuffs for the day. I know people are preparing to work and all those stuffs. Okay. Yes. So 44. Yes, 44 is B. You need to probe further to know, okay, what is going on. So 45, a client taking haloperidol develops painful neck spasms and upward deviation of the eyes. Which adverse effect should the nurse suspect? A client taking haloperidol develops painful neck spasms and upward deviation of the eyes. Okay. Upward deviation of the eyes. Okay. Which problem are we looking at here? Upward deviation of the eyes. Upward deviation of the eyes. Painful neck spasms. 45. Yay. I said it. Yay. 45. I know 45 will trick a lot of people. Okay. This is a clear sign of what muscle problem. Okay, so if you look at the extrapyramidal symptoms, this one, haloperidol is a first generation medication. Okay, so extrapyramidal APS symptoms. The first one is what? The dystonia, the akathisia, and the tardive dyskinesia. This is purely muscle problem. Okay, so they will be having muscle pains, muscle rigidity, no, muscle pains, spasms, and all those. Rigidity will come here. Spasms, occlugeric crisis. They have changed this English. Nclex is very smart. Okay. Upward deviation of the eyes. If they have mentioned occlugeric crisis, you know it is A. But because they changed the English, people were choosing B. Akathisia. Akathisia mostly affect the vital signs, like the muscles will be having more spasms, but you don't see occlugeric crisis in akathisia. Akathisia, heart rate will go high, blood pressure will shoot, respiration rate will shoot. So over here, you concentrate on managing them. So you give them antihypertensives and all those medications that will reduce what the vital signs, connect them to the heart monitors and all those stuffs. Okay. And tardive dyskinesia is what? The rigidity, when the rigidity set in. Yes. So remember this acronym, the DAT, in what? The mnemonic, the DAT. So acute muscle dystonia, akathisia, and what? The tardive dyskinesia. Okay. Remember it too. Yes. If everything fails, then later they can develop what we call the NMS, neuroleptic malignant syndrome. Combination of all these with muscle rigidity. Okay, good. Let's continue. So 45 is A. 46, our last four questions. A client taking an antipsychotic says, I can't sit still and is constantly pacing. Which adverse effect is most likely? 46. Sorry, Parkinsonism. The DAP. Sorry, Parkinsonism. Yes, you are right. It's DAP. DAP. From Parkinsonism, you go to tardive dyskinesia. Then from tardive dyskinesia, later they can develop. I mean, it's very rare. The NMS, neurologic malignant syndrome, is DAP, DAP, not T. Okay, yes, the DAP, yes. So the P is the Parkinsonism, having that rigidity. Okay, 46, shoot, 46, shoot. Yes, so this is a clear example of what? Constant pacing, cannot sit, akathisia. So in Ghana, we call it akathisia. They are all everywhere. Okay. A client taking 47, a client taking antipsychotics develops tremor, rigidity, and a shuffling gait. Which condition should the nurse suspect? Tremors, rigidity, and shuffling gait. Which condition should the nurse suspect? 47. Shuffling gait. Shuffling gait. I like your answers. Wow. Shuffling gait, tremors, rigidity, and shuffling gait. This is what changed the answer. So, what is the answer? Which condition are we looking at? 47. Yes. So, Sarah, Sarah, okay. So the answer is A, drug-induced Parkinsonism. Okay. So Parkinsonism, they are walking, those Parkinson's sign, then they are dragging their feet. They are dragging one feet on the floor, shuffling gait. You shuffle. They say shuffle. Shuffle in bed. Move to your side. So they are shuffling. You drag their feet on the floor. Okay. Classical signs of what? Parkinsonism. Not serotonin syndrome. Serotonin syndrome, they are crazy. Oh. They don't sleep. Okay. So 48. A client taking an antipsychotic developed repetitive lip smacking and tongue protrusion. Which condition should the nurse suspect? Repetitive lip smacking and tongue protrusion. Lip smacking and tongue protrusion. Hey, people know, people are sharks. So. Yes. Hey. Lip smacking. Hey, hello. God should, God should take all these problems from us and our families. Yes. So it's what? 48. Yes. It's a clear sign of tardive dyskinesia. Tardive dyskinesia. Tardive dyskinesia. Okay. 49. A client prescribed an MAO, monoamine oxidase inhibitors, reports severe headache and palpitation after eating aged cheese. Which complication should the nurse suspect after eating aged cheese? Aged cheese. Which complication are we looking at? Monoamine. Yeah, 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 yeah. Monoamine, yes. The last but one question. Mhm. 49. Oh, that's good. It means you people read. You read a lot. Good. So 49. Age cheese. You've left age cheese. Okay. So tyramine will be increasing. You're not supposed to take monoamine or this linezolid with this tyramine containing product. Otherwise, you cause what we call hypertensive crisis. Okay. Perfect. Right. Last question for the day. Then tomorrow morning, same time, we start. But remember, today in the afternoon, we have a class. We have our normal class, Mondays to Thursdays, our normal class. Okay. Yes. So question number 50. A client taking benzodiazepines becomes excessively sedated after drinking alcohol. Which risk is the nurse most concerned about? Excessively. They have qualified, not they have used a qualifier for us. Which risk is the nurse most concerned? Question number 50. Everybody should shoot. Benzodiazepines and alcohol. Yes. Good. Perfect. Right, guys. So our time is up for today. 7 o'clock exactly. I've told you nowadays I'm not crossing my time. So we started at 5 and it's 6:59 a.m. at my end. So exactly 2 hours for questions. Tomorrow to the same time, 2 hours. We finish the last 50. Okay. There are 100 questions. So don't miss class. Today, our normal time, we will continue our basic care and comfort, basic nursing, basic care and comfort. Okay. Yes. So remember, we started last week. We didn't finish. Okay. So today we will continue with it. Join and learn. Okay. Perfect. Thank you so much, everyone. And God bless you. Don't forget to like and share the page. Like, like the page. Subscribe to the channel. Hit on the subscription button. When yes, and share for others to join. Yes. Thank you so much. Thank you. Thank you. Before you leave me, I want to see our normal bye bye. Bye bye. Our normal bye bye. Okay. Our normal bye bye. Hey, Elizabeth, you are now answering 36. Our normal bye bye. You like, you share, you like, you share, you type your bye bye before you leave. I want to see your bye bye before you leave. Okay. Let me see your bye bye. Yes. Let me see your bye bye. Yes. Let me see your bye bye. You like, then you share. You like, then you share. Yes. Let me see your bye bye. Thousands of love for you. Thank you so much. So tomorrow, same time. Today, today, 1 p.m. So at my end. So now it's 7 o'clock, 7 2. So we have, let's say 12 is 5 hours, 13. So we have 6 hours more to meet again. Okay. In the next 6 hours, we are meeting again. If you are new on the page, this is my number. Chat me. Okay. This is my number. If you're new on the page, chat me on WhatsApp and I will send you the group link to join. Okay. Yes. This is a free channel. It's a free page. It's a philanthropy work we are doing. We are helping nurses. Okay. All over. So Share the link to your friends, let them join. Okay. Share the link if you're a student nurse, if you are a practicing nurse, join. Okay. Join. Your problem, let me know your area. Okay. Yes. So if you get to me and you tell me, oh, Mr. Paul or Paul, I have call me Paul, don't add any Mr. Okay. I have a challenge in this area. Okay. Can you help me understand? Why not? I don't work alone. I work with my administrators. Okay. So even if I don't get time for you, I can refer you to someone. So when I refer you, don't be angry that I've ignored you. No, we work as a team. Just that I'm doing the presentation, so you think I'm alone. No, I work with three other administrators. Okay, yes. So please let me get to me, take my number, WhatsApp me, and let me know you. I want to know you. You are part of my group. I want to know you. So chat me. That's my number on the chat box. Chat me. Okay. Yes. Call me. I want to know you. Send me message. Me, I'm somebody I don't like making calls. So I like this thing rather chatting. So that's my number. Chat me. Okay. On WhatsApp. Thank you so much. Okay. Perfect. God bless you all. Bye bye.